Many of our clients are financially and emotionally ready to retire before the age of 65, but they're held back by one rather large concern, and that is the cost of health care before Medicare kicks in. So today we're going to talk about 3 options that might be a good fit for you if you find yourself in this situation. So the first option includes just staying on your employer's plan. Why don't you give us some details about that?
So if you already have healthcare coverage at work, the easiest solution might be to simply stay on the plan. They can't deny you. You don't have to switch doctors or networks or anything like that, but there's a big catch. You have to be 63 and a half or older, because that falls under the COBRA regulations, and COBRA is only for 18 months. So the way it works, Amber, is if you're over 63 and a half, you can stay on the COBRA plan. You simply pay the full amount of the premium. You lose any subsidy that your employer may have paid. So that's probably the most expensive way to have health insurance before Medicare kicks in at 65.
So the most expensive way, but also a way that you can keep your same doctors and have the comfort of being on the plan that you're familiar with.
Easiest, for sure.
Easiest. Okay, so the second plan that we want to talk about is what?
Well, under the Affordable Care Act, also known as Obamacare, you can enroll in your state's health care exchange. Now, as a result of that legislation, everyone can get coverage. Doesn't matter what your pre-existing conditions are, what status your health issues are, you can get coverage. Now, there are some restrictions to that. So there is open enrollment that goes from October to December each year. But if you are currently covered under your employer's plan and you're retiring, so this is at any age. Now, this is not just 63. You can be 60 years old and get this same coverage. You can then go to your state exchange and get healthcare coverage that way. And what's nice about that is that it has all the networks, right? Different networks, different insurance companies all compete in this exchange.
So this is going to be probably a more moderately priced plan. Let's look at some costs.
So Amber, I've given an example here on the screen. In Minnesota, we're looking at a silver plan. So the way that these exchanges work, they have gold, silver, and bronze plans. So we picked kind of a middle of the road plan for a 63-year-old in Minnesota. We've given you 2 options here, a deductible of about $2,100 a year and a deductible of about $2,800 a year. You're responsible for your primary care visits. There's no co-pays or anything. This is a pretty standard plan. It's considered silver. You can see here $760 for the one with the higher deductible, or $865 per month for the slightly lower deductible.
So this plan could be a great fit for someone actually who has a lower income, because this is for someone who is not getting any subsidies. These numbers we put up is for no subsidies at all. But if your income is a little bit lower, your prices for this exchange are going to go down. Great
point, Amber. So the way that works is when you enroll in your state's exchange program, you'll tell them your anticipated income for the year. So as Amber mentioned, if your income is below certain thresholds, you may get a subsidy to where the government actually pays a portion of your monthly premium. So your cost might not be $800 a month, it might be $600, $500, even $400 a month based on that subsidy. And then every year you have to update your income to keep that subsidy going. So again, anyone can apply. And if you're leaving coverage from an employer, there's no set time frame. Now, if you were self-employed and you had your own coverage before, you can't just jump onto this except for during that open enrollment period.
Okay, so this is a great fit for some people. The third option that we want to talk about is an option that we really like, but again, it's something that only works for some people. So what we're talking about here is actually not health insurance, but it's health sharing. So let's talk about how that works.
So Amber, health sharing is different than health insurance. See, the health insurance companies have to offer certain coverages, and they have to accept everyone under the Affordable Care Act. So it doesn't matter how sick someone is, they can get coverage. Health sharing works differently. It's really geared towards people who are healthy already and just want to have that catastrophic coverage. But I want to show you the premiums for this are substantially lower. So if you're in good health, this is what I suggest you look at first. Determine if this type of plan will work for you and your family before then moving on to the exchange. So let me give you some examples of how this works. So We had already shown you the price of the exchange plans. Here you can see for someone between ages 50 and 64, with a $2,500 deductible, or what they call in the health sharing the initial unshareable amount, a $2,500 unshareable amount is $240 a month for a member. So Amber, go back to the example of over $800 per month without a subsidy on the exchange for a 63-year-old. The deductibles were similar, $2,800 and $2,100. That was $865 a month. This is $240 per month. So a huge difference, okay? But you have to understand that this does have some limitations.
Before we look at limitations, let's talk about what it does actually cover.
So Amber, on the screen here, we'll put on here cost sharing, right? That is the member, the health sharing member has a need, they experience a medical event, they can share that after that initial unshareable amount of $1,000, $2,500, or $5,000, whatever the member elects. They do have coverage for preventative care. Telemedicine is included at no cost. They do have a prescription drug plan, and you can add mental health coverage. So it is similar in that it's providing coverage for your health care costs. So in that regard, they're both the exchange or your COBRA plan, they're all trying to cover your doctor's visits and unforeseen medical issues.
So this is a huge premium savings over other plans. So who would it not be a good fit for?
Amber, this would not be a good fit for someone who has pre-existing conditions, meaning some major medical condition that they've received care for in the previous couple of years. So I'll throw on the screen here how that works. You'll see that they exclude coverage for a pre-membership medical condition. That means if you had seen a doctor, been treated, or received care for a certain illness prior to enrolling with this company, which is actually Zion Healthshare. You can see that as you go after in the first year, there's no coverage. In year 2, 3, 4, they increase some coverage. So I say to people, it's really not a good fit if you've had a major health event. But look at the bottom. Exceptions to that for high blood pressure, high cholesterol, and diabetes. What does that mean? It means if somebody has high cholesterol, high blood pressure, or diabetes, they can still qualify and receive coverage for this under Zion Healthshare. So it's the major stuff they can exclude, and that's how they're able to keep those premiums down. They're not insuring the people who are already sick. They're only insuring people who are relatively healthy now who might become ill in the future.
So if this plan interests you, you can go to the website on the screen and check it out. If you have questions about it, you can always contact us for a free 15-minute phone call.
Yeah, I suggest you go there and really dig into the guidelines, who's eligible to join, what's covered, see if it works for you. We made the decision over the years. We've done other health sharing plans. We've done the exchanges. Our personal family, we have decided that this is the plan that we are moving forward with. We are on it now. And we're very excited about it. It's saving us a ton of money every month, but we also had no major pre-existing conditions to be concerned about. So that worked for us. That might not work for you. If you are relatively healthy, this could be a real game changer to that monthly budget, really allowing you to say, boy, if I don't need an extra $500 or $600 a month for healthcare, maybe I can retire a little sooner, which is really what we're trying to help people figure out. Can you afford to retire? Let's try to take that healthcare coverage concern off the table.
Go to the website, check it out, and go to workwithnewgen.com to schedule a 15-minute phone call with us to make sure you understand all the details.
Because you can make the rest of your life the best of your life.
Plan now to retire happy.